Chapter 14, Part 5. Cognitive therapies are a group of psychotherapies based on the assumption that psychological problems are due to maladaptive patterns of thinking. Treatment techniques focus on recognizing and altering these unhealthy thinking patterns. Psychologist Albert Ellis developed Rational Emotive Therapy, RET, which focuses on changing the client's irrational beliefs. The key premise of RET is that people's difficulties are caused by their faulty expectations and irrational beliefs. In RET, psychological problems are explained by the ABC model. When an activating event A occurs, it is the person's belief B about the event that caused emotional consequences C. Changing the core irrational beliefs that underlie personal distress is the first step in RET. The second step is for the therapist to vigorously dispute and challenge the irrational beliefs. Rational emotive therapists tend to be very direct and even confrontational. From the client's perspective, rational emotive therapy requires considerable effort. The person must admit his or her irrational beliefs and accept the fact that those beliefs are irrational and unhealthy. The client must radically change his or her way of interpreting and responding to stressful events. RET is generally effective in the treatment of depression, social phobia, and certain anxiety disorders, and in helping people overcome self-defeating behaviors. Psychiatrist Aaron T. Beck developed Cognitive Therapy, CT, which focuses on changing the client's unrealistic beliefs. Beck discovered that depressed patients have developed a negative cognitive bias, consistently distorting their experiences in a negative way. Beck believes that depression and other psychological problems are caused by distorted thinking and unrealistic beliefs. The CT therapist encourages the client to empirically test the accuracy of his or her assumptions and beliefs. The client learns to recognize and monitor the automatic thoughts that occur without conscious effort or control. The client learns how to empirically test the reality of the automatic thoughts that are so upsetting. CT therapist strives to create a therapeutic climate of collaboration that encourages the client to contribute to the evaluation of the logic and accuracy of automatic thoughts. CT is effective in treating depression, borderline personality disorder, anxiety disorders, eating disorders, PTSD, and relationship problems. It may also help prevent depression from reoccurring. Cognitive behavioral therapy, or CBT, refers to therapy that integrates cognitive and behavioral techniques and that is based on the assumption that thoughts, moods, and behaviors are interrelated. Cognitive behavioral therapists challenge maladaptive beliefs and substitute more adaptive cognitions, and they use behavior modification, shaping, reinforcement, and modeling to teach problem solving and change unhealthy behavior patterns. CBT is a very effective treatment for depression, eating disorders, substance abuse, and anxiety disorders. It can also help decrease the incidence of delusions and hallucinations in patients with schizophrenia and psychotic symptoms. This concludes this part of Chapter 14.